We're learning more this morning about Michael Jackson's prescription drug use. One doctor is speaking out about what he gave Jackson. Meanwhile, the biggest mystery remains, where is his body? Here's CBS News correspondent Ben Tracy.
In the surreal saga that is Michael Jackson's death, the question now is, where is his body?
Gone too soon.
His casket was front and center at the memorial service, but its whereabouts are now a closely guarded Jackson family secret. We do know that at least portions of the singer's brain are still at the medical examiner's office, being tested to see whether Jackson had any neurological conditions that may have caused his death.
If the brain is observed as normal, then the issue becomes the toxicology report.
That could show whether prescription painkillers Jackson allegedly took played any role in his death. It could also determine if the singer was using Diprivan, a powerful anesthetic he may have taken to battle insomnia. Meanwhile, TMZ reports the Jackson family gave investigators a list of doctors who may have been overprescribing medication for Michael Jackson. It reportedly includes Dr. Arnold Klein, Jackson's longtime dermatologist. On Larry King Live, he denied unethical behavior in his treatment of the pop star.
I had to keep reducing the dosage of what he was on, because he came to me with a huge tolerance level.
Toxicology results, which could show exactly what killed Michael Jackson, may take weeks. Ben Tracy, CBS News, Los Angeles.
Although we still don't know what killed Michael Jackson, the stories about his prescription drug use and alleged abuse highlight a growing problem in this country. The federal government estimates 15 million Americans abuse prescription medication. Gil Kerlikowske, the director of the Office of National Drug Control Policy, joins us exclusively this morning from Washington. Mr. Kerlikowske, good morning.
Good morning.
Investigators in the Michael Jackson case are looking at this sedative Diprivan, which Michael Jackson's nurse told us that he begged her for, which was reportedly found in his home. I don't think people realize this is not a drug that people have in their homes. If a doctor did in fact prescribe it, do you think he or she should face criminal charges?
Well, Maggie, I'm not able to talk about the very sad and untimely death of Michael Jackson, but what I can certainly tell you is the issue of prescription drug abuse, which the Office of National Drug Control Policy has been kind of shouting about from the rooftops for the last several months. It is a significant problem in this country.
But a drug like Diprivan, will you explain to people someone should not have this in their home? This is a very serious drug that should be administered by a doctor.
Well, Maggie, when we look at what's killing people in this country as far as drugs, as recently as looking at 2006 data, more people were dying of drug overdoses than were actually dying from gunshot wounds in the United States. I think that should tell everybody, and certainly Michael Jackson's very sad, the loss of him is a wake-up call to this country. So all of the prescription drugs have legitimate medical uses, but the key is they're being abused, and the key is that parents can actually help prevent a lot of this, and there are a lot of ways to do that.
This is such a wake-up call for parents, or it should be anyway, because teenagers, use of prescription drugs among teenagers is on the rise. How are they getting it?
The medicine cabinet. So we listen and talk a lot about what's coming across borders, etc., what's being manufactured in homemade labs. All of these prescription drugs are coming out of medicine cabinets, sometimes out of hospitals or extended care facilities, and parents, again, are the key to being able to stop this.
How?
The anti-drug, all one word, theantidrug.com has a ton of information that parents can go to right away. But securing those medicines, talking to your kids about the dangers of prescription drugs, when used properly, they're oftentimes lifesavers. When used improperly, they can result in terrible problems, addiction and death.
It's such an important conversation, and I'm so glad we're having it. Gil Kerlikowske, thank you very much for joining us.
Thank you.